So my name's Katie Bingham. I am a geriatric psychiatrist working with Waypoint. I also work with the North Simcoe Muskoka Specialized Geriatric Services, which is an organization that's affiliated with Waypoint, and I'm the physician lead with that program. So this grant that we recently received was funded through the Canadian Institutes for Health Research, CAHR, and it is a $750,000 three-year grant that is allowing us to the opportunity to study a clinical program that was already in service through North Simcoe Specialized Geriatric Services as well as Waypoint. And the program that we'll be studying is called the Behavior Success Agent Program. It is a program that serves people living with dementia who are hospitalized in acute care hospitals. And what the grant will allow us to do will be to study the program in detail and kind of describe the program, describe what might be some of the challenges with the program, the opportunities with the program, and really understand it, and then work with a large collaborative team to be able to optimize the program further. Once we understand it more, we'll be able to optimize it more. And that will also allow us to kind of build a roadmap so that the program can be scaled and spread to other interested organizations. Research addressing dementia in general is becoming, there has been a focus on this area for a number of years. It's only increasing as the rates of dementia are increasing. I think what is very interesting about this particular opportunity, though, is that it is looking at a very practical strategy that will directly improve the lives of people living with dementia and their care partners, as well as hospital staff and the system as a whole. And, in my opinion, there hasn't been enough of this type of research that's actually looking directly at systematically studying models of care to help us to be able to really refine them and grow them. So this is a very needed area when it comes to research in dementia, because people living with dementia really experience significant challenges when they're admitted to hospital. And so do their care partners, so do hospital staff, so does the system as a whole. So looking at an innovative program like the Behavior Success Agent Program really will address this gap in the literature as well as in services. So the way that this research will change practice is addressing the lack of evidence for what is the best way of supporting people living with dementia who are hospitalized. So people with dementia who are in hospital can experience a number of different challenges. So things like agitation, confusion, a variety of different, we call them neuropsychiatric symptoms or behavioral and psychological symptoms of dementia that really impact on their ability to receive care, their quality of care. They can lead to, we know that people hospitalized with dementia do have more negative outcomes, and really are in need of a clinical service or a program that addresses those issues. This particular program is already in place, so we know that this model seems to work. I work directly with the program, so we know it seems to work, but we don't exactly know why it works. We don't necessarily know what are the barriers and facilitators to allowing it to work as well as it can work. We don't know what are the different factors at play in the different hospitals and hospital systems that influence how well it works. And having that information will allow us to be able to improve the program, and will also give us evidence when it comes to, thinking about for other hospitals that may not have this type of a program, because it is, there are different programs in different regions. We think that this one is unique and may be effective, or aspects of this program may be effective at other hospital sites and systems. So this particular study will provide a roadmap that could be used, used at other organizations as well, and develop further evidence for how to best support people living with dementia in hospital. And then hopefully that will, not only help their quality of care, but will also help to improve the system as a whole. So, for instance, people with dementia in hospital end up having to stay in hospital a lot longer, oftentimes because it's harder to, find support for their needs when they leave the hospital, especially if they do have significant behavioral symptoms, like I described before. And we find that this program improves those symptoms and allows them to leave hospital sooner. But we want to figure out, why does that happen, and what are some of the factors at play that allow them to, to have a smooth transition out of hospital and into their next destination. So the way this program specifically works is that there is a clinical staff member who is already a staff member of the hospital. It's usually a nurse, a registered practical nurse, but it can be anybody, any healthcare professional who's working in the hospital, and they are referred patients who have dementia and may have these behavioral and psychological symptoms. And then at that point, they're able to do a detailed assessment of the person and understand who they are as a person, as an individual, what strategies might be helpful for them, what things are potentially triggers or may not be as helpful for them, and really develop a care plan in terms of strategies that will help staff, like help the patient, help their care partners, as well as help hospital staff like nurses to be able to support them better in the hospital. And they also link with other resources. So they would make referrals, for instance, or facilitate referrals to someone like myself to review things like their medical status, their medications, other things that, could potentially help to improve their quality of care in hospital. And the other part that is unique about this program is the behavior success agent, so the clinician who's doing that work, is also connected with a community of practice that's led by North Simcoe Muskoka Specialized Geriatric Services that provides that regional connection, mentorship, capacity building, and allows us to sort of stay connected as a region, so different hospitals aren't doing different things. So it's it's it works as a collaborative system, and I think that's part of what's unique about this project and part of what we really want to be able to study. So we hope that with this grant, we'll be able to work with multiple partner organizations to optimize the quality of care for people living with dementia who are in hospital in the North Simcoe Muskoka region, and then ultimately to be able to improve quality of care for hospitalized people with dementia in other regions as well.